what does your company do? And, who's using it, who are the users, and how are you impacting health equity?
AmplifyMD is a virtual care efficiency solution that connects hospitals, clinics, and correctional facilities across the country to remote specialists so patients can get essential life-saving care whenever and wherever they need it. We have a 50-state footprint with over 15 different specialties covered, supporting over 200 facilities and facilitating over 100,000 specialty consults through our platform this year. And what is the problem we're solving? The fact that there's a huge shortage of specialty physicians in this country, with over 50% of our hospitals without access to specialists in at least 3 critical fields. We have vast specialist deserts throughout the country, especially in rural, low-income, and underserved areas, with patients in these communities often unable to afford traveling long distances for routine or emergency specialist care, exacerbating disparities and creating additional financial hardships for patients and their families. So how's AmplifyMD solving that? We're enabling remote physicians to seamlessly cover multiple hospitals and clinics in a single shift, often in different states and health systems, using multiple EHR systems with a single simplified login and platform. This efficiency allows our specialists to work 2 times more efficiently so they can care for more patients in the same amount of time across a wider region so that we can deliver access to care whenever and wherever it's needed. Our approach is about strengthening local access, tackling the physician shortage through efficiency, and ensuring continuity of care, and helping hospitals keep their doors open and deliver essential life-saving services wherever they are needed.
How have you really moved the needle with a particular group in your work?
Yeah, as you can imagine, with both physicians and the platform driving efficiencies and access to care, we're making some significant improvements. In the outpatient setting, we're taking patients and hospitals that have wait times of 6 months to 9 months for seeing new patients in the outpatient clinic, cutting that down to 48 hours, adding thousands of appointments available to these communities, and cutting patient leakage, which means a patient has to leave their local community to get care, by 80%. In the inpatient setting, we're cutting transfers by 80 to 85%. We're increasing CMI, which means the level of complexity of the local patients. It's a real key measure for hospitals, from in the mid 1.4 to 1.7, to the mid 2s to the mid 3s, which means there's more they're able to treat more complex patients locally, which is amazing for the patients who don't have to be transferred and can get care at home, but also for the hospitals who can keep their doors open without losing the revenue that these patients would otherwise bring in. We're helping patients in the ED with stroke times and response times of 30 to 38 seconds. We're helping psychiatry patients who come in off their meds and needing to be stabilized without having to be committed to an inpatient unit by responding to them in minutes, not hours, so there's no ED boarding. We're helping all these patients throughout the country, regardless of location, get the access to the care they need so they're able to go home healthy and better.